See, there are
Okay.
classifications in
Procoxib.
4 ways, like selective COX inhibitor, this is atirocoxib and nimesulide. Then preferential, we are preferring more aceclofenic, the derivative of diclofenic itself. So both.
Yes, sir.
Non-selective are aspirin,
Yes, sir.
naproxen and all this. And anti-inflammatory and antipyretic,
Okay.
that is paracetamol.
Yes,
So in
sir.
selectivity base,
Okay, sir.
previously there were celecoxib and rofecoxib also, but since they are banned in India, so nowadays only atirocoxib we are
Yes,
using.
sir.
And nimesulide is also selective,
Okay,
okay?
sir.
What are the doses of all TB drugs?
Yes, sir.
So good morning, Dr. Ajit.
Good morning, sir.
How are you?
I am fine, sir. What about you, sir?
Wonderful. So you are coming in AMC and your preference is Navy, right?
Yes, sir.
So we want to learn, ask from you, first of all, like, what do you know about Navy? Then we'll have some medical questions, personal, professional questions with you, okay?
Okay, sir.
And then we'll justify that what were right and what improvement we need, okay, after the interview. So
Okay.
carry on with the
Okay,
first.
sir.
Since you're interested in Navy, I want you should speak on Navy first of all.
Okay, sir. The
Start.
Navy Day in India is celebrated on December 5th of the every year, and the motto of the Navy is "Be auspicious unto us." And the there are three commands in Navy, starting from west as Mumbai, and south as Kochi, and east as Visakhapatnam. And the post is in Navy starts from the commanding officer starts from sub lieutenant, lieutenant, captain, uh, commodore, vice commodore, rear commodore, and then chief admiral.
Okay, okay. What are your, are you listening me? What are your achievements?
Yes, sir, I am. So my achievements, as I can mention, so after completing my MBBS from Ukraine, I cleared my FMC examination in very first attempt, and I do have an more stronghold in medicine department, and I do have a self-based experience of working as DA for around 2 years, and I have good command in different languages like Tamil, Telugu, Malayalam, Hindi, and English, sir.
So can you introduce yourself in Tamil
Sir, I
language?
can't able to hear you.
Can you introduce yourself in Tamil language?
Yes, sir.
Tell your hobbies in Tamil
Yes, sir.
language. Only hobbies.
ஓகே. என்னுடைய ஹாபிஸ் என்றால் புதிய கலாச்சாரத்தை ஆராய்வது, புதிய நண்பர்களை உண்டாக்குவது, கிரிக்கெட் விளையாடுவதும் ஆனது.
Okay, so you love interacting new personality, exploring, especially in cricket is your favorite.
Yes.
Okay.
Yes, sir.
And if I tell you to tell about your strengths in Malayalam, then?
ഓക്കെ. എന്റെ ബലങ്ങളെ നോക്കിക്കഴിഞ്ഞാൽ ഞാൻ ഫോക്കസും ടീം ഓറിയന്റഡും പിന്നെ ഒഴുക്കമാനുള്ള ആളാണ്.
And in Telugu, you tell us
Yes, sir.
about the meaning of your name. What does Ajit mean and how it is similar to your name?
ഓക്കെ. എന്റെ പേര് ഡോക്ടർ അജിത് കുമാർ ആണ്. എന്റെ പേരെന്ന് വെച്ച് കഴിഞ്ഞാൽ വിക്ടേരിയസ്. എന്റെ പേരിനെ പോലെ തന്നെ ഞാൻ കോമ്പറ്റീറ്റേഴ്സ് എന്താ ഇഷ്ടം.
Okay, you are a competitive person. Okay, you studied in Ukraine, so definitely there must be some difference you find in India and Ukraine education. So what difference you find, especially?
Yes, sir. First of all, I would like to mention the first difference as there are more theoretical courses comparing to India and less practicals in Ukraine. And the second difference, I would say, the course contains 4.5 years in India, but in Ukraine we have 6 years of course.
Okay, now my next question is, like you stated that you have already an experience of medicines, right? Almost 2 years experience you're having.
Yes, sir.
So can you tell me the details of your education experience, where you worked and what you learned and all these things in your 2 years of experience?
Yes, sir. Sir, in my 2 years of experience, almost 1.5 year I worked in ICU, medical ICU, intensive care unit. So I came across almost all kinds of practical emergency situations, like starting from the airway obstruction, patients who require ventilatory support, tracheostomy, tracheostomy, and the patients are in with shock, different type of shock like hypovolemic shock, cardiogenic shock, septic shock, anaphylactic shock, and the patients who is in severe dengue condition, who is coming with the complaints of upper GI bleed and lower GI bleed, and patients of road traffic accidents, and the traffic and the patients related to case of poisoning, so etc. So,
My next question to you
may
is,
I take your burden, sir?
yes, yes. You tell me
Yes,
about,
sir.
you told so many things you have learned in your experience. So you tell me
Yes, sir.
about food adulteration. Like, how would you explain and how would you manage this thing?
So, food adulteration is first of all mixing any kind of substance which is mixed with the natural food,
Right.
and because of the patient can end up in poisoning cases.
Okay.
So, first of all, when the patient comes with this kind of scenario, so we see the symptoms of the patients, which it contains, it can be CNS excitability, such as bradycardia, hypotension, or it can be related to the gastrointestinal symptoms like the patient contains diarrhea, vomiting, pain abdomen, etc. So, according to the symptoms, we will come to the provisional diagnosis, and according to that, we will manage the patients. And also, we will take the samples for the medical legal cases as urine toxicology and blood toxicology. And if it requires that we suspect an toxic poisoning, then also we do the gastric lavage and preserve the sample as well, and notify the police officer.
Okay. You belong to Vellore. So can you tell something about your city,
Yes, sir, sure.
please?
So Vellore is located on the banks of the Polar River, and it's in southeastern district of the Tamil Nadu, which is covering an area of 2030 kilometers square and having a population of 16 lakhs 1400 and 242. And the important places in Vellore, I can mention Christian Medical College and Hospital, Vellore Institute of Technology, Sripuram Golden Temple, and Vellore Fort, which is the most important historical part which takes place in Vellore. So,
Okay.
and Vellore is also called as in second Madras.
Second Madras. Okay. Why it is called Second
Yes,
Madras?
sir. There is an interesting thing that because of importance of place in history and also the landmark.
Okay.
As a landmark, Vellore is located in an well-connected cities to the nearest states like Telangana and Andhra Pradesh, Kerala and Karnataka, and also having a border with an international maritime north province of Sri Lanka, and also the Puducherry, Union Territory of Puducherry, sir. And the historical importance, as I would like to mention, the Vellore Sepoy Mutiny, where the Indian soldiers, for the first time ever, braved to fight the British soldiers. The reason for that is British, during that time, the Vellore Fort was in the jurisdiction of the British chief commander of the Madras Regiment. He ordered the Indian soldiers who stationed at the Vellore Fort to wear the same act like an British soldiers, by replacing the traditional wearing of galleries and turbans of the Indian soldiers. So it takes place in 1806.
Okay.
So that is a very important historical event I could mention in
Okay.
Vellore
Okay.
district, sir.
Now I'm asking you the another question. What are the doses of all TB drugs?
Yes, sir.
Few
Okay, sir.
classes.
So first of all, the TB regimen, the latest update consists of two HRZD plus four HRE. So the HRZD, the dosage of isoniazid is 300 mg, and the dosage of rifampicin is 600 mg, and the dosage of hydrogenamide is 150 mg, and the dosage of ethambutol is 100 mg. So,
Okay. Can you classify NSAIDs?
Yes, sir. So NSID is as a broad we classified as selective and non-selective. Yes, sir. It's in selective and non-selective non-steroidal anti-inflammatory drugs. In selective, there are subdivisions like an phenolic acids like the ketorolac and indomethacin and phenolic acid as an mefenamic acid and the salicylates like aspirin. And in non-selective non-steroidal anti-inflammatory drugs, celecoxib and eterocoxib, and the preferential non-steroidal anti-inflammatory drugs that we use in regular practice that includes diclofenac, aceclofenac, and naproxen, sir.
Okay, you answered well. Selective, you told heterocoxib at selective or non-selective?
Eterocoxib, sir.
Yes.
Heterocoxib is a non-selective, sir.
It is selective, dear. Because see, there are
Okay.
classifications in
Heterocoxib.
4 way, like selective COX inhibitor. This is heterocoxib and nimesulide. Then preferential, we are preferring more aceclofenac, the derivative of diclofenac itself. So both.
Yes, sir.
Non-selective are aspirin,
Yes, sir.
naproxen, and all this. And anti-inflammatory and antipyretic,
Okay.
that is paracetamol.
Yes,
So
sir.
in selectivity base,
Okay, sir.
previously there were celecoxib and rofecoxib also, but since they are banned in India, so nowadays only heterocoxib we are
Yes,
using.
sir.
And nimesulide is also selective.
Okay, sir.
Okay. Okay.
Okay.
Okay. Give
Thank
me
you for
the
updating my knowledge, sir.
okay. Give me the classification of antibiotics.
Okay, sir. So antibiotics classed based on the mechanism of action. The first group is like cell wall synthesis inhibitors, which includes beta lactam and
Macrolides,
glycopeptides. Beta
quinolones.
lactam
Give
includes like
examples of macrolides.
okay, sir. Macrolides. Sir, macrolides consist of like an drugs called as streptomycin and canamycin and amikacin, sir.
Roxithromycin, azithromycin, clarithromycin, quinolones are ofloxacin, levofloxacin. These are quinolones.
Okay.
Go through it nicely, okay?
Okay, sir. I will go through it, sir.
Okay, how many types of insulins are there?
Sir, first of all, starting from rapid insulin,
Right.
which includes like Lispro, which starts acting in 15 minutes and effective lasts for around 2 3 3 hours,
Okay.
and then regular insulin, like an human regular insulin and Novolin, which starts acting from 30 minutes and lasts for around 3 to 6 hours, and then rapid drugs, no, sorry, long-acting drugs, which includes uh, Humulin, which starts acting from 2 hours and effects last around 12 to 18 hours, and then long-acting drugs, which is like Glorgine and Lantus, which start acting from several hours and can effective can up to 24 hours. And there are very long-acting drugs like Tugilac and also one more drug which start acting from several hours to 40, 48, 42 plus hours. Sir.
Wonderful. Can you tell something about snake bite? How will you manage the
Okay,
case?
sir. Yes, sir. So the first and foremost thing in a snake bite management is to reassure and counsel the patients, because the most reason for the mortality in snake bite is panic. So we will first of all reassure and counsel the patient and take a brief history, like which kind of a snake and in which part of the body part that it's an bite, and we will try to locate the flying mark. First of all, it's an venomous or non-venomous by finding the flying marks, and then we will try to conclude the uh, group of the snake venoms, like either it's an hemotoxic or it's a non neurotoxic, and also the symptoms can help us to conclude the group of the venom. Like for example, if it's a bleeding from an flank site, or if we are giving an IV injection and it's also bleeding from the IV injection site, and there is an swelling and lymphadenopathy, and also like blackish color like a necrosis. So that's mostly towards the venom, hemotoxic snake bite. And if the patient comes with the complaints of diplopia, ptosis, signs of paralysis, and respiratory difficulty, that's more towards the neurotoxic snake bites. So the neurotoxic snakes are like cobra and crate. But sometimes the crate flying marks are most of the times is hidden. So there is an kind of a confusion between that, but we should know that in the beforehand. And hemotoxic snakes mostly viper. The most common is an Russell viper and saw-scaled vipers. And if we conclude the patient as an neurotoxic snake bite, then we will give atropine 0.6 mg and neostigmine and glycopyrrolate according to the situation. And if we conclude that a patient is in case of an hemotoxic snake bite, then we will it's a condition like a DIC, disseminated intravascular coagulation. So we will try to do the more further investigations like a fibrin degradations and the clotting time, bleeding time, and we manage accordingly. But if it's in a general, if it's in includes either as a neurotoxic or hemotoxic, so we will administer the anti-snake venom, which is basically covers these four snakes, like which common snakes like in neurotoxic and common snakes in hemotoxic. So we will take 5 ml of anti-snake venom and dilute in 100 ml and give slowly. But in the beginning phase, before giving the anti-snake venom, we should also have in our hand like an antihistaminics, adrenaline, because most of the patients can have an hypersensitive reaction to the anti-snake venom, sir.
Wonderful. Speak on ascites.
Thank you, sir. Okay, sir. Sir, ascites is first of all an free fluid more than 25 ml in an third space of the abdominal cavity. That can be either because of an infective condition, a malignancy condition. So that we will try to diagnose establish the diagnosis by doing the paracentesis and then sending the samples to the investigation and look at the SOG ratio. And if the SOG ratio comes more than 2, that's most probably because of the conditions like cirrhosis of liver and the portal hypertension and the cardiogenic related diseases. But if it comes less than 2, that it's an like conditions like malignancy, those kind of situations. And they can also try to find out by examination like percussion. Like in percussion, we will feel the findings like a dullness and the shifting dullness. That's an air fluid bubble vibration that we tap on one side and feels the vibration on the other side of the blind side.
Yes. In AMC, it was asked clinically, how will you diagnose steps of percussion and what is shifting dullness? They asked like this in AMC. Okay, now you tell me about aminoglycosides.
Okay, sir. Sir, aminoglycosides includes streptomycin, kanamycin, amikamycin, and sir, these drugs mostly we prefer to use an parenteral route because it has a less gastrointestinal absorption, and also the drugs does not cross the blood-brain barrier, so that it doesn't usually effective for an CNS infections. And these drugs are mostly used in a TB treatment. In the first line treatment, we use the streptomycin, and in a resistant TB, we use the kanamycin, either amikacin. And so these drugs can also cause ototoxicity because of its deposition in perilymph and endolymph, and also nephrotoxicity because of its deposition in medulla of the kidney.
Wonderful. You answered very well. Most of the questions really I appreciate. And your personal questions and the way you are speaking is good now. We'll have one more mock session.